Hi, everybody. This is Ketel here from the Hoffman Institute at INSEAD. A very warm welcome, second time, for all of you joining us on this webinar series entitled Navigating the Turbulence of COVID-19, where we bring faculty members from INSEAD to share some of their insights as they relate to the unfolding crisis seen from their particular disciplines. And today we will be focusing on inequalities. And to discuss inequalities with us today, we are welcoming Mark Stabile. Mark is a professor of economics at INSEAD. He's also the Stone Chaired Professor on Wealth Inequalities. He's the academic director of INSEAD Stone Center, studying wealth inequalities, and he's also the deputy academic director of the Hoffman Institute. So I work very closely with him. Before joining INSEAD, he was with the University of Toronto, where he created and headed the School for Public Policy and Governance. He's advised a number of governance on healthcare reform and child poverty programs. And his areas of expertise are on inequalities, obviously, also touching poverty, child health, healthcare financing, and tax policy. Thank you very much for joining us today, Mark.
It is a pleasure to see you online and to join everybody this evening.
So, so that we can start this conversation, and that's also because this is what you, the audience, have asked us to do. Could you please give us, a big picture overview of where we are in terms of inequalities, how that influenced the way we were prepared or not to that crisis, and how the crisis is also exacerbating some of these inequalities. So I'll give you, 10, 15 minutes to set the stage, and then we'll enter the conversation. Over to you, Mark.
Sure. Yeah, I'd be happy to do that. I'm going to share some slides with you. Here we go. I think the place to start here is to start with a graph that probably many of you have seen in some way or another over the last few years. And this shows you the trend in income inequality over the past 100 years in the United States. And this is one way of measuring inequality. It's looking at the share of income that the top 1% have. And it shows you with and without capital gains. And let me just make 2 or 3 quick points about this. The first is, and this is important for today, that starting from the late 70s, early 80s, and moving on up, we see that there has been an increase, a substantial increase in the share of income held by the top 1%. The 2 other things I want to note, and we may come back to them in the discussion this afternoon, is that before that, it was a period of relative stability in inequality at a lower level. And that before that, going back before 1945 or so, there was a period where it was higher again. So it went from high to lower to high. If we instead look not just at the United States, but at a selection of countries in the US, Europe, and around the world, we see what we might call a convergence. Not every country has followed the same path. Some have had more rapid increases in inequality. Some have had less. Some have even seen a decline. But what I would be prepared to say is that we went from a place in the 80s of, let's say, somewhere between 5 and 10% to a slightly higher level of income held by the top 1%, somewhere between 10, 15, 20%. Okay? A similar convergence can be seen if we flip from the top 1% of income earners to the bottom 50%. So this is the poorest 50% of income earners in a population. And you see a similar convergence. Some countries had a more rapid decline, some stayed even, some saw even a bit of increase, but we went from a place where we had a higher amount of income held by the bottom 50% to a place today where we have less income held by the bottom 50%. If I take away the other lines and just show you the EU, for example, where I am today, you see a rise on average across the EU from 7 to 10% for the top 1%, and a decline from somewhere around 25 to about 22% for the bottom 50%. Okay, so again, a convergence to a higher amount for the top 1% and a lower amount for the bottom 50%. Now, why is this important to the discussion today? Let me say 2 things about why we think this happened, and I think it will be important for our discussion. So the first thing to know is that economists actually don't agree on all of the reasons why inequality rose between 1980 and 2000 and afterwards. But we do generally agree on two things. The first is that at different times, different things played a role. And the second is that there's a combination of things going on here, some of which we would call market forces, such as globalization, automation. And these kinds of forces were not necessarily policy decisions, and are not necessarily things we could even completely undo, but they increased travel for sure. They changed the way we think about supply chains, made them more global. They increased our interconnectedness. And that, of course, has implications for the way we are managing COVID-19 today. The second is there were a series of policy decisions, and these policy decisions also affected inequality. The biggest of these are probably decreases in tax rates and the tax bases. A number of countries through the 1980s decided to lower their top tax rates, collect less revenue. This had the effect of reducing the size of government programs, making public services more lean and more efficient. And again, I think this has implications for the way that we are thinking about COVID-19 today. But let me focus in, just to keep our discussion going, on at least two ways in which COVID-19 interacts directly with inequality. And the first is inequality's relationship with health, and the second is inequality's relationship with work. And I'll start with health because I think this one is a little more straightforward, even if equally disturbing. So what do we know? And let me say, in the area of understanding COVID-19, there is so much new information happening, coming out all the time. This comes from a paper from scientists in China about their episodes of COVID-19. And we know that there are several things that predict if you have a severe COVID-19 response relative to a not severe, okay? And these things include many chronic conditions that people can have, including hypertension, diabetes, cardiovascular disease, and a couple of others that you see here. Now, that's not just chronic conditions. We also know that the elderly are more vulnerable, and some other groups are also more vulnerable, but these chronic conditions are important. In fact, if you look at the crude death rate coming out of China by these conditions, you see that relative to having none of these conditions here, having hypertension or having cardiovascular disease or diabetes, you have a much higher probability of dying from COVID-19 if you have one of these diseases, unfortunately, okay? Switching from the Chinese data and experience to the Italian Chinese experience, again, another enormous outbreak of COVID-19. And if you look at the most common comorbidities of those who died from COVID-19 in Italy so far, unfortunately, we see that compared to having no comorbidities, if you have hypertension or diabetes, again, all of these underlying chronic conditions increase the probability of death, hypertension being the biggest, but lots of others contributing as well. Okay, what does this have to do with inequality? The key thing that we need to know about how this contributes to inequality, or how inequality interacts with this, is understanding who is likely to have these chronic conditions. Now, of course, we all know people of different income levels who have some of these chronic conditions, but the fact is, and this is data from Canada, that if you look across income quintiles, and you look at the bottom income quintile, which in this case are these circles, and you look at the top, the highest income quintile, which in this graph are the squares, these blue squares, you will see that over time, taking a collection of 17 high impact chronic conditions, the bottom quintile is way more likely to have these chronic conditions. In fact, 15 percentage points more likely to have these chronic conditions. And in fact, they're more likely than the second highest income quintile, who are more likely than the third highest income quintile, and so far up the road. And so what you see here is some pretty consistent evidence that shows you that lower income people are more likely to have exactly those chronic conditions that are more likely to result in a severe episode of COVID-19 and perhaps death, unfortunately. Okay, so that's the health angle, and I'm happy to come back to that in the question and answer discussion. Now, how about inequality in work? Well, inequality has changed, COVID-19 has changed a lot of our lives. Almost everybody, I would say. Here we are on Zoom having this kind of webinar. A lot of us have adjusted by working from home, Some of us have had to go on to partial unemployment, some of us full unemployment, some of us are trying to continue to work outside the home. This reality, again, is not equal for all people, okay? Different people have had to respond in different ways. Particularly, there have been a group of people, and I'll come back to this in a second, that have been deemed, of course, essential workers. And these essential workers, whether they're your healthcare workers that we're all celebrating the great job that they are trying to do in this moment, whether they're grocery clerks who are still allowing you to purchase food at stores, whether they supply that food to the stores, whether they're Amazon workers, street cleaners, all of these people are continuing to work despite the risk of doing so because these jobs have been deemed essential in many countries. Now, let me show you a few data points on how this interacts with inequality. The first, this is something that comes from this weekend's New York Times, and it shows you how, comparing the top 10% of the income distribution and the bottom 10% of the income distribution, people moved into self-isolation. Now, everybody is isolating more, at least trying to. But what we see from these data is, in fact, it happened much more quickly and at a higher rate for those, the blue line being the wealthiest, than it for the orange line, the poorest. 3 days may not seem like a lot in normal time, but in COVID time, 3 days turns out to be a significant amount of time. And the poor were less able to isolate quickly and less able to isolate as extensively as the rich. Now, a second question is, which jobs are those that can be done from home and which jobs cannot? And again, new data coming out just this week or last week on the share of jobs that can be done by home. Again, this is US data. And you see there's quite a difference between the top 5 jobs that can be adjusted to home work, professional, scientific, management, education, finance, information, and the bottom 5, where it's much more difficult to adjust to home work, transportation, construction, retail, agriculture, accommodation, and food. And of course, who has these jobs is an unequal distribution. The top jobs, the authors of the paper say workers in the occupations that can be performed from home typically earn more than those in the bottom 5 and along the distribution. What we did is we went and collected some information from the UK, looking at all of those jobs that we took all of the occupations and we took the median income in those occupations. And we looked at which of those jobs the UK government has deemed essential. They have to keep working, and those non-essential, they don't have to keep working. The black dots, non-essential, the red dots, essential. And as you might expect, you get some interesting information out of these data. Let's take a look at some of these red dots that are here on this side, which is more of the low income earners. And you see that's where your shelf filers are, your care escorts, your retail cashiers, the pharmacy dispensing assistants, the sales and retail assistants. These are essential jobs deemed by the UK government, but they don't pay all that well. Now, there are some essential jobs that pay better. And of course, again, let me say the medical practitioners are doing an enormous job at some risk, and they are paid more. They're down here towards the top, and pharmacists and police officers are also towards the top. But what's clear is that among those jobs that are deemed essential, forcing people to be out there working, they are earning money, and that is a positive thing, but they're also exposing themselves to more risk. There are a number of jobs that you would not put in the same category as doctors, and they don't pay like doctors either. Okay. The last couple of points I'd like to make, and then I think we can have a broader discussion, is the extent of unemployment has been enormous. Right? We've seen so many people either on partial unemployment or full unemployment. This graph, which comes from the Bureau of Labor Statistics in the Department of Labor in the United States, shows how enormous it is. Right? We thought that things were going crazy on the week March 15th to 21st when we saw 3,300,000 people file for unemployment, up from 300,000. The next week, it jumped to 6,600,000. So we have seen enormous amounts of unemployment coming out of this. It's been fast and it's been hard. And of course, you're far more likely, they haven't published this yet because this is moving so quickly, but you're far more likely to be in this group if you're not in the top 1% of income earners. So let me summarize, sticking to our 10 to 15 minutes and then open up the conversation. The underlying causes of the rise in inequality are not unrelated. This globalization, this change in the way and size that government functions are not unrelated into the way that we're managing COVID-19 today. That's not to say that it could have necessarily been prevented. I don't want to say that, but I do want to say that there have been implications for how we're experiencing it from decisions we took in the past. The probability of catching COVID-19 if exposed might be equal. Some have caused it something that we're all in together. But I would question whether we really are, because even if the probability of catching COVID-19 is being exposed, catching if you're exposed is equal, the probability of exposure surely is not equal. There are many more low-income workers being exposed, as well as important medical care professionals who are out there as well. The underlying risk of being exposed, if you're exposed, is not equal. We saw that those with chronic conditions are much more likely to have severe cases, and those are more likely to be low-income people. The decision of whether to work from home or whether to work at all is not equally available. And the ability, of course, to manage in an induced economic shutdown, which we have today, is not equal. And so, although we're all in it together in some sense, I think we are experiencing this quite differently. And I think from there, I'd give it back to you, Catel, and we can have a discussion.
Thanks, Mark. I think that sums it up. We're all in this together. We're not experiencing it the same way. And this is what I would like to discuss a little bit with you. And that relates to the response that has been given to the situation. And obviously, governments have responded differently to support workers. In France, we have, for instance, a system, and not just in France, but in other countries, that has managed to keep workers away from unemployment. So the graphs you show for the US doesn't apply to all countries because some schemes have been put together. My question to you is, to what extent is this type of response that focuses on the employers keeping their contracts with employees is also contributing to inequalities or not? Are there people who fall through the cracks of these kind of schemes?
Right. Well, those are great questions. And, I set the stage with some information on what's happening, but the question of how we're responding to what's happening is super important. And you're right. Different countries are taking very different approaches. I think all of them, let's start with the general comment that we have seen an amazing response in terms of the magnitude and indeed the speed of governments around the world in dealing with this problem, in different ways for sure, but a lot of action and a lot of money has been put on the table by a number of different countries to try and deal with this. I think it's maybe helpful, before I talk about who is left behind in all this, thinking about what you're trying to do in a policy response. And let me even before that say that it's important to note that the health response was certainly, the health problem was certainly not by choice. The economic shutdown that we're experiencing is a choice that we made to protect public health, right? So this is a bit different from other situations where economies have crashed, in that we have put the economy on hold in many countries to try and protect ourselves. Okay, so that is huge and important. Now, having done that, governments are trying to deal with the loss of income, the loss of work, the vulnerabilities. So what are we trying to do? Well, the first thing is people need to get money and to be able to live, and they need to get it quickly. Okay, and so responses are targeting individuals who need money, and responses are targeting firms who generally have work, but in this period don't. The second is they are trying to put out policies that will protect people now, but that might also allow for us, when we take the economy out of this deep freeze, and it's been a severe, to restart it in a reasonably efficient manner. The third is that we are trying our best to target resources at people who need them more rather than people who need them less, because we don't have unlimited resources, and some people, as we just noted, are certainly in more need than others. And the fourth, and here I think different governments have really managed this differently, we know from lots of other work that these kinds of situations, losing your job, not knowing how much money you're going to have next week, whether you're going to be able to feed your family, managing the health anxieties of COVID-19 are extremely difficult for people. And to the extent that policies can help with that, that's also a good thing. All right, so I would put those 4 considerations before we talk about what countries are doing.
Yeah.
In terms of what they're doing, yeah, go ahead.
So let's go with, so thanks. I think it sets the stage, and then let me ask you a few questions about certain initiatives, and to go back again to the one around, you know, workers, and does that, you know, trying to also equalize the support with everybody working, making sure that no one gets unemployed, does that cover everything? I mean, I know you've done research on gig workers. We have a lot of headline news focusing on gig workers. How are they covered by schemes like this?
Yeah, well, a lot of the times they slip through the cracks, right? So we've had 2 big types of policy responses. Policy response 1, try to protect the job even if for now the person cannot do the job, right? Countries like France have done this, Denmark, lots of others as well, Canada, which is to try and provide some income support through the employer, saying we will give you some support for these workers if you don't fire them. We recognize they can't work now, but we want to hold that job. Okay, so this has lots of nice properties. 1, it provides support. It recognizes not everybody can work right now. It keeps that employment contract so that when, and hopefully soon, this lifts, they have a job to go back to. The alternate response is let's get money out to as many people as possible. And the US is doing a version of this. Let's try and transfer $1,200 or $1,500 to everybody as quickly as possible. Again, some nice properties. People need the money to survive, and we're giving it to them. However, the employment relationship is not necessarily protected, and you're seeing these spikes of unemployment. How about those workers that don't have traditional jobs and that are not in the traditional tax base, right?
Yep.
One category of worker like that are gig economy workers, those people who are either doing some small, you know, delivering your food or driving an Uber car. Another category, very similar to gig economy workers, would be people who are not necessarily using an app, but are cleaning your home for cash or are doing small fix-it jobs for cash. These people have fallen through the cracks of this protection system, okay? Now, some countries are trying to figure out how do we recognize that these people need support, but it has been much more difficult because there isn't a natural way to provide them with support. In some countries, you know, some people call this the underground economy, some people call this the black economy. The size of this economy in Europe, the IMF most recently estimates it for different countries at between 10 and 40%. It's a lot of workers who, and these are rich countries, never mind in developing countries, who don't have a traditional job, who are not getting paid in traditional ways. And so they're eligible neither for unemployment protection or insurance, or for, you know, the kind of relief that comes from immediate checks being sent out for those of you who filed the tax form last year, because they didn't do that either, right? And so these people are really suffering.
Yeah, I think a lot of questions that are coming up here and that were also shared before have to do with, you know, looking ahead. And what that crisis is also bringing up is some, you know, resurfacing some questions about the future of work. For instance, we see resurfacing the whole question about universal basic income as one way, same thing of leveling the playing field for everybody. You've also worked on that. How are you seeing that solution, that proposal in the current context? Is this something we should revisit?
Well, so let me say that the priority right now should be, there should be 2 priorities. 1, making sure we have as much of a medical system in place as we can to protect people who have medical needs. And 2, making sure that people can get by today, hopefully keeping their job so that it's easier to transition out, but making sure we're supporting them today. So the basic income, in a sense, and the idea for those of you, I think probably many of you are familiar with it, where everybody gets a certain amount of money every month from the government, has a nice property in that everybody is getting something, okay? And so at a minimum, they would have, let's say, what the US is sending out today, $1,200 per person. However, there are a couple of problems, I would say, with thinking about that is the solution to the situation we're in now. The first is it's very poorly targeted, right? So sending out $1,200 may not be enough for someone who has nothing left and a family to feed and rent to pay and more, all of those things. And it may not be necessary for someone who is working efficiently from home, and certainly inconvenienced, but not at a point of financial catastrophe yet. And so that kind of general policy is not a very efficient way to get resources out to the most needy. The second is that in thinking about an immediate response, right, if we had a basic income in place, we would say most of us would have sort of baked in, so to speak, our lifestyle to accommodate it, right? I would be part of what goes to paying for my food and my rent and my clothes and my children, etc. If you lose everything else you had, except for the basic income, you'll still have something, but you will still need a lot more support than that's providing you with. And it's very difficult. And as soon as you get away from a policy where you just keep everybody the same, it's very difficult to on the fly adjust person to person how much you need from a basic income. Usually we do this in those versions of a basic income that say, if you have less, we give you more. And if you have more, we give you less. We do it once a year at tax filing time. But here we need to respond very quickly. And huge programs responding very quickly, that's a challenging ask of any government, no matter how efficient, which is why the employment relationship, saying we know exactly what's going on with these people who are employed, although it has the problem of those who are not employed, at least is a slightly more efficient way to help those people in the moment. So to sum up on that one, I would say that a basic income in some forms, you know, one that's more of a negative income tax form, certainly could have a big place in society, but it would not solve the problem we're in today, in my view.
Yeah, thanks, Mark, for this. Still looking ahead, what you've shown in particular in terms of what are considered essential jobs and less essential jobs, are that the most essential ones are the most low-paid ones. Do you foresee after that crisis a change in what's considered essential, and how redistribution would change that that inequal status between what's essential but what's low paid?
Yeah, I think that for many people, this crisis informed us as to what's really essential. I think a lot of us, probably all of us, started by thinking, yes, of course, doctors are essential, right? And so are the nurses and the other healthcare professionals. All of those people are essential people. And I think when they go into that profession, they know that. Some of them are compensated better, some worse, but they know that, you know, if you work in the ER in times of crisis, you are essential. I think that for the most part, food delivery workers, cashiers who have maybe 0-hour contracts, you know, home cleaners, well, not the home cleaners are not working now, but home support people, these kinds of people that are still out there working every day, and my garbage is still being picked up every day. I don't know that we thought of them as essential in crisis the way they're proving to be today. And I think that for some groups of those people that have very precarious employment, and you know, I think a lot of food cashiers, for example, 0-hour contract, precarious employment, it doesn't make sense at a society level to say at the same time, these are people who are going to be poorly paid and not have much job security, and yet we're going to deem them essential. I mean, how can you be prepared for anything if you're working that way, right? And so I think that one could hope that when we make it through this, and eventually we will make it through this, we could revisit the kinds of employment relationships that some of these workers have to say, you know, we understand that next time things go completely crazy like they are today, we're going to need you to go out there every day and sell us our food, or bring our food to the markets, do all of these things that we need to keep going, and we're going to recognize that in the way that we support your employment. I mean, I think that should be a step forward here.
Yeah, thanks for being optimistic, because in the conversation on the future of work, we've had a lot of tech conversation, right, around what tasks can be automated and what not. And here, that crisis also brings that extra dimension of what is not just part of the caring economy and hence can be done by humans, but also is essential to making our society work on a daily basis. So that's more a comment from my part. Sorry, I'm supposed to ask you questions. We have some.
I agree.
We have some questions here You've spoken, of course, a lot about government response, and that's what we've seen so far. And when it comes to inequalities, we think about government's action first. We have some questions about the role of businesses when it comes to inequalities and the role of business now and later. What can they do? How can they complement public response and public policy in general?
Yeah. So one of the biggest issues, and in this case, it's a huge example of business and government working together, is that a lot of these programs are saying to business, we need you to try and keep your workers if you can, right? So one of the things, obviously, and you need to have the support systems in place, but in those situations where businesses can ensure that the employment contract remains, let's not just think about the relief and the mental, to the extent that we can, reducing stress in the moment now for your workers. Let's think about when this starts to open up again. The government decides that we can begin to restart the economy. If you're a business that has fired all your workers, you're going to have a slow start, right? It's going to be very hard for you to pick up speed in a reasonable way, and it's going to be hugely inefficient for those workers to be all looking for new jobs. If you've been able to retain your workers, obviously, that can lead to a much more efficient and rapid response. So I think the biggest thing that businesses should be doing at this moment is making sure that in some way they are staying connected with their workforce, hopefully keeping them employed with the support of government if that's possible and required, to allow for a start when a start can happen. The other, I should say, because there's a health point to all this, right? There's an economics point, but there's a health point. Is to the extent that businesses can keep a connection with their employers on their mental and physical health, understanding their health needs. Maybe they can't help, but just to have someone else who's checking up on you, right? Because we have really never been in a situation where we have been so isolated so suddenly. And a lot of people are feeling that they know they're not supposed to go to the emergency room unless they can't breathe, and everything else along the way is unclear. And that's a very difficult situation for many to be in. Right. Yep. And so having a touch point with your employer, not that the employers are going to provide necessarily the healthcare, but to just check in and say, are you doing okay? Do you need help? Are there things that are not clear to you? Do you know how to get to a doctor if you need it? Right. These kinds of things, I think, provide an extra source of community that people need. But the biggest one is, to the extent possible, let's keep these employment relationships intact and not have 6 million new applications for unemployment insurance. Right? This is going to be. I think
that was 10 millions over the 2 past weeks, if we accumulate, right?
Yeah.
So that's right. That's for business. What about the responsibility of the top 1%? Any views on whether the conversation around wealth tax is also popping up around the current situation as far as redistribution is concerned?
Yeah. So what's certainly happened in the last few weeks is that governments have spent a lot of money, or are promising to spend and put out a lot of money that's going to have to be reconciled in the future in some way. Right. And so I think that the conversation about what can the very top income earners do, and the wealthiest in terms of not income, but just also wealth, what can they do to help support the economy once we're through this, is to understand that starting to refinance some of all the stuff that we've put out there is going to be hopefully a progressive endeavor, right? Where we're going to have to ask those people that were least hit by this and are most able to help us recover from it. I don't see any other way. We will recover slowly, that's for sure. But it's going to have to be a collective effort to get us back on track. And frankly, if you look back in history, last time we had to recover from such a horrible tragedy like this one, it was a collective effort that time too.
Yeah, so let's pause a little bit on that as well, and unpack that a little bit, so that we look back to think forward. That's often useful. There was a couple of questions in the preparatory questionnaire that were connected to what we can learn from these previous major crises, previous recessions, previous wars, and what's happened to inequalities after that, and why we responded the way we did. And in particular, there was one specific question about the fact that these wars and pandemics can be somehow play the role of equalizer because they tend to reboot the economy. So can you speak to that a little bit and tell us what we can learn from this past experience to look forward?
Sure. So if you go right back to the first slide I showed, where it showed a decline in inequality, then flat, and then a rise in inequality, right? This question sort of pertains to why did we see that decline in inequality after the war, after the Great Depression? And I'd say there were two contributing factors, at least two contributing factors. The first was that a lot of capital was destroyed. It wasn't the same as today, in the sense that today we've put the economy on hold by choice to protect our health. That time, a lot of it was physically destroyed. But nevertheless, lots of capital was lost. And, to the extent that people who have capital are the ones that lost it, of course, that can produce a slightly more equal society at the end. However, a second thing happened, which is that coming out of the war, we started to see the development out of two wars and a Great Depression, we started to see the development of a certain type of economy that was different from what came before it. We saw in various countries the beginning of public healthcare systems. We saw the beginning of social safety nets. We saw the beginning of education, massive education programs for soldiers who came back. And we saw an increase in the tax structures available, partly to finance the war, but remaining in place to help finance these social safety nets. And all of this led to a more equal society coming out. So it wasn't just the destruction. It was what we did after the destruction that was most important for what produced the period we have afterwards. And, we will have opportunities to have that conversation again. We've seen the destruction of a lot of economic capital, this time because we had to put the economy on hold. We've seen a lot of human capital destroyed too, lots of people sick, unfortunately, and dying. Coming out of this, we will have a chance to rethink, what do public healthcare systems need to look like? What do income support programs need to look like? What does the system need to do to repay and support some of these? And then, you ask, what can the 1% do? I think at that point, they can help contribute to making that kind of society function better.
Thanks. I mean, I'm glad you're optimistic because this is what we need. But history tells us also we should be. The final question I want to ask you obviously has to do with other countries. We focused a lot on Western countries, a lot on internal inequalities. What's the situation in certain countries in Asia, in low-income countries in Africa, knowing that they're much less well prepared, that there is a huge informal sectors? What are the proposals put forth there to respond to the crisis?
Yeah. So let me recognize that as hard as this has been in rich countries, and as hard as it still is in rich countries, it's going to be extremely difficult in developing countries. A few of the things we know. So first of all, the governments there don't have the resources available to do these support programs for businesses the way that Western governments have. So even if we would like businesses to retain their workers, there isn't the same kind of financing available. And I know that, supranational organizations like the IMF and World Bank are, of course, trying to support this, but this is going to be harder because they don't have as much resource on the ground. The second thing we know is that the informal economy plays an even bigger role in many of these countries, right? And there are millions of people in countries like India, for example, who are paid only cash, right? Do not have a formal employment contract. Many of them don't even have a bank account. And so the idea of getting money to people is even more challenging, even if we could identify who those people were. Some of them are not on the record. And so in this context, I expect that there will be, unfortunately, even more suffering in these countries than we've seen here because there are so many more that are going to be falling through the cracks of what's available. And then there's the health side, right? If we have been reading article after article about the shortage of ventilators in Western countries, you can only imagine the shortage of ventilators in those countries that have just feeble and developing healthcare systems. And so we'll probably see a much greater health tool there. So all in all, that's not an optimistic answer.
Yeah.
It's going to be much more difficult there.
Is it fair to say, however, that when governments are designing their recovery package, the role of official development assistance here is an important one to keep on? First point. And second point, the role of multinational companies also having supply chains. So through their supply chains, potentially being able to support employers and employee in this context. Are these valid suggestions?
Yeah, for sure. Anything that can be done to help support employers on the employment side, I think makes a lot of sense, right? Because there just isn't the same infrastructure on the ground to do it. On the health side, you have to believe, and we're starting to see this, that as countries get through the worst of it, and you've seen this from China and you're starting to see it elsewhere, they are starting to move healthcare resources where they're now more needed, right? They built up their, they've through the worst of theirs and they're shipping them here in Europe or to North America and hopefully to the developing world as well. And of course, this is going to be required, right? This should be, in a sense, a collective effort. It needs to be a collective effort. As we go through our peaks here, we need to work with those organizations to start to move some of those resources to where they're needed more.
Thanks, Mark. We have to wrap up. I'm watching the time, you're not, so you don't realize. Before I conclude, what makes you the most hopeful? I mean, you've worked on inequalities for decades, including, post 2008. What makes you the most hopeful in the way we're going to come out of this one?
Well, I mean, let me say again that if someone had told me 2 months ago that governments would have produced trillions of dollars in support. Now, there's even more need than there is support, don't get me wrong, but that they would have produced trillions of dollars in support to help workers keep their job, to help unemployment insurance programs get bigger quickly, to help consider things like basic incomes for every citizen like they do in the United States. These kinds of programs, where we're now talking about, okay, but who was missed in this program? We're no longer talking about, are we going to spend the money and help the economy, these people now? We did it now, right? We're not through it, but governments are mobilized and they're working with business. This is a very hopeful story because I think many people would have said a month ago, I don't believe that they would ever be working together in anywhere near the time we need to make a difference. We're not through it yet. So I hope that I'm not speaking too soon, but we have seen a huge mobilization, right? The amount of response from government and business and citizens alike has been enormous, and that's what we needed in this moment.
Thank you very much, Mark. And let me add that as a school committed to promoting business as a force for good, a lot of learning here in terms of the role of business, the role of government, how they work together, and bring this in the classroom so that we rebuild a better system moving forward. Thank you very much, Mark, again, for your time and your insights. Thank you, all of you, for joining. If you are interested in discussing more about the impact of the crisis on the economy recovery package, but more from a macroeconomic point of view, join us on Thursday with Antonio Fatas, Professor of Economics at INSEAD, who will speak to that topic. You will be receiving an email after that webinar asking you for feedback. We are listening to your feedback. We are improving as we go. Please respond. And if you want to continue the conversation, because there were a lot of great other questions that you raised as well as comment, you can join this new platform we've developed on LinkedIn. The address is here. You will have it in this follow-up email as well. And let's keep the conversation flowing so that we also learn from one another over there. Thank you to all the team who's behind that. You don't see them, but they're all here doing a fantastic job. Have a wonderful evening, and we'll see you then on Thursday for the next conversation as part of our INSEAD series on navigating the turbulence of COVID-19. Bye-bye.